My name is Brady Click. I'm CEO of Healthcare Anytime. Healthcare Anytime provides its products through a software as a service model for hospitals. We provide it in such a way that the hospital can focus on what they do best, which is provide healthcare and not providing IT services to their patients.
We have to deal with a variety of information, sometimes structured, sometimes unstructured. Unstructured being things like doctor's notes or images. A big data platform allows us to get this high velocity, high volume of information into our environment in a way that we can access it quickly and easily. We knew from the beginning that we had a big data problem. What we didn't know was what we needed to do to get all of the pieces put together and working together. That's where Datastax came in.
I think to understand big data, it helps to think about the nature of healthcare data. Most healthcare data is very loosely structured. It varies greatly from one information system to another.
At one point, we reached a threshold of 20,000 patients per hour being added to the system, and we simply couldn't get past that without adding a tremendous amount of hardware and processing capability. We needed a high volume, high velocity, highly scalable, highly available solution that's fast and flexible. We found that there are a number of companies that could help us address specific data management and processing needs, but none of them provided a comprehensive solution until Datastax introduced integration of Solar with Cassandra and Hadoop.
Datastax allows us to bring systems that will help our hospital and clinic customers utilize the data they have in these information systems that have been around for many, many years.
The combination of Solar, Hadoop, and Cassandra is really powerful. When we bring on a new customer, there's an avalanche of data that occurs. We need to take in all the information we can get, process what we know we need, and be prepared to reprocess what we discover that we need in the future.
The big data platform allows us to do things we otherwise really couldn't with a small team of developers.
Implementing Datastax Enterprise was pleasantly smooth for us. We attended some first-class training events and have received quality, timely support from senior engineers. Standing up a cluster in a cloud-based environment really couldn't have gone much smoother. Within a day, we had an environment up and running. We were able to access, store data, get information back out. Within a week, we were up and operational with a cluster and pretty close to ready to go to production. The real advantage was we did not have to add any additional resources.
With OnTrack, I can access information again at the tip of my fingers. My name is Joe Henches. I'm from Clear Lake, Minnesota. About a year and a half ago, I started having chest pains. Thought it was a heart attack. Ended up going to the hospital immediately in St. Cloud. They realized the condition was an aortic dissection, or had about a 5% chance of living. It actually was a pretty serious condition to be in. Most people that go through that don't survive, so I was fairly lucky. All the medical personnel that I've dealt with in the last year and a half are pretty amazed when I tell them that I had an aortic dissection and I lived through it. So in that way, I feel pretty happy to be alive. I started using OnTrack, and keeping on top of my medications has helped me a great deal. Being able to communicate well with my doctors when I go to the doctor office. I can hand them my iPad and they can see medication I'm taking, the dosages.
The concept behind the patient portal is to provide an efficient mechanism to continue to engage the patient when they leave the doors of the clinic. We send the patient their laboratory results. We send the patient their medical record summary that tells them what happened in their encounter. We also engage the patient in helping them understand what their medications are that they need to be taking, why it's important for them to take them, and doing things like monitoring at-risk patients for things like their body weight and other key indicators that allow that provider to see quickly what may be going wrong in the patient's health care.
We're talking about human lives here. Scalability, speed, reliability, it's critical. Just because we have the shiny new Datastax hammer in our toolbox doesn't mean everything becomes a nail. We do have relational databases still in our environment. We're going to continue to use them where they're appropriate, but Datastax definitely solves a problem that relational databases simply cannot do.
Datastax provides us with a distinct competitive advantage. It allows us to engage patients much more effectively than our competition.